A woman loved madly. Let's explore what happened. JP was a 21-year-old college student when, in 1971, her mother reported that she has gone crazy over a boy and has been acting strangely for the past several days. She had become obsessed with a male student in one of her college classes. She believed he loved her and wished to marry her. Marriage is a big step in any relationship, so it was worrying that she believed this despite the fact she only knew this man as a classmate. She never had any personal conversations with him and had never spent time with him outside of class. She stated that she knew he loved her and that she was attracted to him because of the intensity of his love for her. She stated that he was empty without her and was pursuing her, but that several faculty and students were plotting against them to keep them apart. She stated she could not enter into any other relationship, as this would constitute infidelity towards the object of her affection. She stated she would wait for him forever, and that many famous people, including the President of the United States of America, were aware of their love. JP came from a middle-class family. Her father was a postal worker and her mother a nurse. She had a twin sister and a 2-year-old sister. She was far more introverted than her twin and was an avid reader, studious, highly moralistic, and a loner. She had always been distrustful and suspicious of others. An intimate relationship had recently ended, and JP's mother reports she was very upset at the time. JP was well-groomed, well-dressed, of medium height and build. She was very courteous and overly formal in her interactions with the interviewer. When speaking about anything other than the male student she was obsessed with, she was rational, coherent, and appeared well. She did not spontaneously raise the topic of the male student or the alleged plot. However, once either topic was raised, she would go into excruciating detail about the messages she believed he was sending her. She also revealed delusions of reference. These are delusional beliefs that unrelated happenings in the world have special meaning for the individual. In JP's case, she believed she was receiving messages from the television, car license plates, and the color purple appearing on clothing. She saw these as proof of his love for her and appeared sad he had not yet proposed. Her delusional beliefs and delusions of reference had been active for more than 1 month, and her family reported changes in her behavior going back more than 6 months. JP denied hallucinations but clearly manifested delusional jealousy, delusional grandeur, and persecutory delusions. While her cognition, memory, and intellect were normal, she had no insight. In other words, she was unable to recognize she was psychiatrically unwell. She had dropped out of college due to her beliefs and growing disorganization of thought and conduct, which left her unable to complete assignments. JP was assessed for both paranoid schizophrenia and erotomania, otherwise known as the Clerenball syndrome. Schizophrenia is a misunderstood illness. Many people confuse it with having multiple personalities with markedly different behaviors and beliefs. This is incorrect. In order to be diagnosed with schizophrenia, the patient must meet 3 criteria. Firstly, they must have 2 of the following 5 symptoms for at least 1 month: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Secondly, there must be a decline in social or occupational functioning. And lastly, signs of the illness must have been present for at least 6 months, with at least 1 month of active symptoms. In JP's case, she experienced delusions and disorganization for at least 1 month, and negative symptoms for more than 6 months. She experienced a decline in social and occupational functioning. She had been somewhat unwell for more than 6 months, although the extent of this had not been recognized by her family at the time. This meets the criteria for diagnosing JP with schizophrenia. Since her delusions were of a paranoid and persecutory type, she was diagnosed with the subtype of paranoid schizophrenia. Erotomania is a very rare type of delusional illness. In erotomania, an individual delusionally believes another loves them and, in return, falls in love with that person. Typically, the other person is of higher social status and the sufferer believes the other person made the initial advances. Its onset is sudden, often following the breakup of a previous relationship. Hallucinations tend to be absent and the course is chronic. It can occur either on its own or in conjunction with other illnesses, typically paranoid schizophrenia. JP's history is one of realizing that the young man loved her initially, that she reciprocated this love, and believes he made the initial advances. The onset was sudden, following the breakup of a previous relationship. Hallucinations are absent, and her course is chronic. It occurred in conjunction with paranoid schizophrenia. Accordingly, she was diagnosed with erotomania also. Insight-oriented therapy began. This is a talking therapy designed to engage the patient around their delusional beliefs and promote insight into the delusional nature of these beliefs. Once this insight develops, recovery is possible. Unfortunately, this therapy proved ineffective. Over time, JP became agitated and distressed that this man had not returned to marry her. She required increasingly high doses of phenylthiazine class antipsychotics as time went by. During the therapeutic intervention, the therapist was variously identified by JP as a friend, someone who may be involved in the plot against her, and, most worryingly, some of the delusions regarding the young man transferred to the therapist. This is not uncommon in cases where there is long-term contact during the treatment of erotomania, but it is very troubling and dangerous when it happens. 2.5 years into JP's illness, her mother suggested that she and the therapist contact the man by phone while JP listened in. She hoped that hearing him say he had no feelings for JP or plans to marry her would promote insight. The phone call took place. The young man told JP's mother and the therapist that he vaguely remembered JP, but he hadn't thought about her since leaving college. He was sorry she had become unwell, but had no feelings for her or any intent to marry her. JP was asked her thoughts after the phone call ended. She insisted that they had not contacted the young man, but had gotten someone else to pretend to be him, and that he would never have said such a thing about me. JP's illness delayed her college graduation by a year. In spite of this delay, she graduated magna cum laude and enrolled in a postgraduate course. She continued to excel in the written portion of her course, but proved unable to do the practical work and dropped out of her master's. 4 years into her illness, she took a job as a clerk in an office. Unfortunately, she quickly became convinced that other employees were colluding with her former classmates, a former teacher, and family members in the plot against her. She quit the job and, over time, her delusion grew to the point that she feared she would be murdered if she left her family home. Consequently, she spent the next 3 years almost exclusively indoors in the family home. She only left the family home when her twin sister visited and took her out shopping. Now, 7 years into her illness, it was obvious she was only getting worse. She was incorporating more members of her family into her persecutory delusions and was keeping a journal in which she recorded many details of intimate coupling she believed she had with the young man. This journal showed that she believed he visited her at night, married her, and had been intimate with her many times. She believed she had fallen pregnant on several occasions. JP believed she had carried these pregnancies to term, but that her parents and therapist had taken the babies from her and given them up for adoption against her wishes. She was, understandably, very angry with her parents and therapist about this. There were several episodes of violent behavior towards family members. This happened when the object of her affection did not visit her when she was expecting him. Typically, holidays, birthdays, and anniversaries were the times this flared up. This led to her being hospitalized for 6 weeks in the 7th year of her illness. She received a course of 12 sessions of electroconvulsive therapy over 4 weeks. Electroconvulsive therapy, otherwise known as ECT, is a psychiatric treatment in which patients are briefly anesthetized, given muscle relaxants, and then subjected to controlled electrical stimulation of the brain. ECT is most commonly used to treat severe depression, but it can also be used to treat schizophrenia and erotomania. JP began to improve during her ECT course. She gained partial insight into her illness, stating, "Maybe it was all in my mind after all. Maybe he is not coming anyway." Unfortunately, this improvement only lasted for 3 weeks before her delusions returned. Despite the use of many different antipsychotics over the years, she has not fully recovered. Her paranoia, agitation, and aggressive outbursts have all decreased. Unfortunately, her erotomanic delusions have remained unchanged. Now, let's put this interesting case into its historical context. The Clérambault syndrome is named after a prominent early 20th century French psychiatrist, Gatien de Clérambault. Despite only being formally described in the 20th century, references to erotic paranoia and erotic melancholy are found in medical texts as far back as the 17th century. It occurs worldwide and has likely been present as long as humans have lived in groups, loved each other, and suffered from psychotic illness. It is associated with high levels of obsessional stalking behavior and can result in violence. One of the most famous recent examples of erotomania leading to violence occurred when John Hinckley became obsessed with the actress Jodie Foster. He shot the President of the United States of America, Reagan, in pursuit of a delusional belief that doing so would cause Jodie Foster to declare her love for him. He was imprisoned, successfully treated, and granted unconditional release on June 15, 2022. He currently maintains a YouTube channel for his music, which I've linked to below. I hope you found this report of a case of erotomania interesting. I've included links to several books which either deal with erotomania specifically or psychopathology in general, for those who would like to read more. These are affiliate links, so if you purchase through them, I'll receive a commission which I'll put towards creating more and better content. Please leave any comments or questions in the comment section, and I'll do my best to answer them. As always, take care of yourselves and each other.